Welcome to Health IT Matters, a podcast in which we explore the ways health information technology is transforming healthcare locally in Florida and on a national level. Health IT Matters is held on the third Thursday of each month and explores the many facets of the ever-growing health IT spectrum. I'm Corinne Slaughterback, your hostess, along with my co-host, Kim Davis-Allen. Providing behavioral health services has its own set of challenges, such as knowledge gaps, access to care, workforce shortages, and the very stigma surrounding the need for services. Varying insurance coverage, lack of coverage, or other financial impediments also complicate care delivery. This last year has exacerbated the need for behavioral health services, but has also provided opportunities in developing innovative approaches in delivering care. Today's panelists represent multiple facets of Florida's behavioral health landscape. I'd first like to introduce Melanie Brown-Woofter. She is the president and CEO of the Florida Behavioral Health Association, or FBHA, a nonprofit organization representing community mental health and substance abuse treatment providers statewide. Melanie is also an active member of the National Council for Mental Well-Being, currently serving as vice chair of the Public Policy Committee. Judy Charus has over 20 years of experience in behavioral health and is a licensed mental health counselor, national certified counselor, certified clinical trauma professional, and certified in EMDR, which is eye movement desensitization and reprocessing. Judy is the director of mental health and substance abuse at Empower, overseeing a program that services over 1,600 clients monthly. Alan Paulin is Senior Vice President of Clinical and Community Services for Meridian Behavioral Healthcare, Inc. He began employment at Meridian in 1997 as a children's case manager, then served as case management program manager, outpatient vice president, and residential services vice president before moving into his current position. With those introductions, let's get started with today's discussion.
All right, well, let's get started. Melanie, I'm going to start with you first. So as president of the Florida Behavioral Health Association, and in that role for several years now, you kind of have the advantage of varying perspectives of behavioral health needs. Can you provide us with a high-level overview of Florida's landscape and what you've kind of seen over those past years?
Sure. Well, first, Kim and Kareem, thank you so much for this opportunity. We really appreciate to be able to talk to everyone about the importance of behavioral health and the recognition of behavioral health and the need for mental health and substance use services during this pandemic and ongoing. And as you say, you know, I've been with the FBHA for a few years now, and I can say that, you know, there are barriers to care. Some of those are being reduced and eliminated. Others are still there. You know, initially, Florida's had a very siloed approach to mental health and substance use treatment in that there were, you know, very multiple funding streams and not an integration of the funding or an integration of data sharing and service provision across the board. So that creates, you know, quite the landscape when physical health and mental health are not integrated, so that you have to go to this person for these services and another provider for this one and another for that, rather than being able to walk into the door and whatever service you need, whether it's a mental health or a physical health issue, you can receive treatment immediately and on site. So, you know, that's there. I do want to say a big thank you to First Lady Casey DeSantis for championing mental health and substance use, as well as the support from Governor DeSantis and the state legislature. You know, stigma keeps many people from receiving treatment, but from the work of the First Lady and the recognition of the stress levels during the pandemic, we're seeing that a discussion of mental health happens in the grocery store. It happens at family dinner tables. It happens in the workplace. And before, discussion of mental health was taboo. It was not something that you admitted to. It was a weakness. It was something that to be hidden away. And now we realize how important mental well-being is to our entire life, to our families, to our children, to us as parents and adults, and to our body, because there are physical symptoms that occur when we don't have mental wellness, which includes substance use issues as well. So reducing that stigma and allowing folks to seek treatment and to realize that it's a strength to reach out rather than a weakness has really made a difference in our state. Access to care remains an issue, as well as workforce. And I think Judy and Alan are going to speak to this, but workforce shortages in the healthcare sector, especially in behavioral health, are just prominent at this point. And so we're really working hard to address those issues and to be able to have treatment providers available for individuals who need it. We're seeing an increased demand for services, which is fabulous, but that we're not seeing an increase in the workforce to be present to provide these services. And so we're having to pivot to some innovations like telehealth. And again, Judy and Alan both are going to speak to some of our telehealth initiatives and how we've been able to expand access to care using that modality of treatment.
I think that's a really great point about the intersection or integration of both mental and physical health. And now we can talk about it. Let's just talk about it. Let's put it on the table and let's get the help that people need. And so switching to Judy, so Empower, your organization, is focused on behavioral telehealth. So tell us about the increased demand. Have y'all been able to keep up, and what challenges you've seen?
And I'd also like to thank you for inviting us, because the more people that are aware of everything we have going on, you know, we're a community. We're all in it. We're all in it together. So Empower provides flexible schedules to meet client needs. Our staff is continuously trained to stay up to date. I make sure my staff practices a lot of self-care so they can continue to provide quality services. Our staff also practices a variety of specialties, so we make sure they're up to date, you know, and they're training for that as well. We've also been hiring therapists to increase staff availability to handle the challenge of additional referrals.
So have you seen a difference in the different markets looking for telehealth services?
Well, I think that collaborative care between medical health care and behavioral health care is needed. What Empower has done is we've built a strong, sustainable model that can forward that experience into other markets. You know, these are exciting times for telehealth. You know, we are the trailblazers in telehealth with several years experience. Empower's been around, you know, for a very long time. We've had time to see this coming, start to build it, anticipate. Right now, we're known to be Florida's premier behavioral telehealth services. We serve the entire state of Florida, and we've been performing since we began 1 million services.
Oh, wow.
Yeah.
Wow. Well, Judy, are there still hesitancies in using telehealth for treatment? Has COVID-19 made a difference in this perception? Areas that we've heard of include lack of knowledge on available services, patient privacy concerns, lack of technology supporting telehealth.
And actually, no, we're seeing more people than ever engage in telehealth. This pandemic has caused so many people to see our staff from the privacy of their own home without fear of spread of the virus. Because, you know, in the beginning, not everybody was vaccinated. A lot of people didn't want to go anywhere, let alone go into an office building, you know, building with a lot of people in it. Our HIPAA compliant platform provides patient privacy, and our platform is also available as an app, which clients can use on their smartphone. I do feel the days of brick and mortar are slowly shifting. For example, how many people are using contactless delivery right now? Groceries, you know, medication, telehealth for doctor's appointments. I mean, 2 years ago, what did the word Instacart, you know, even mean? So all this has changed so much that we're moving into a definite restructure. And it seems that, you know, we've been in telehealth for a long time. We've been an experienced provider for a long time, but we're now seeing firsthand how many face-to-face providers just weren't ready, you know, for the shift to telehealth, and how many clients required that. You know, so we were very lucky. We did not skip a beat in providing services. But, you know, a lot of people have now come into telehealth, seeing that for services in, like I said, so many different ways, that it's the way of the future. A lot of people are now saying they don't want to go back into a doctor's office if they're able to have, a telehealth appointment.
Do you see hesitancies from both providers and patients?
Well, in the beginning, in the past, we did when it was first introduced. So, a lot of it was maybe lack of understanding of technology, or being open and accepting to a new way to provide services. Time and effort was needed for Empower to take the client and provider from education to acceptance. So Empower built a strong communications infrastructure to assist providers and patients to overcome the fear of something new and technological. So we work to assist clients and providers on our platform by utilizing successful education in how our system works. One example is that our own telehealth support specialists are available to walk clients through the process. And also we use it in onboarding, same way, to help somebody feel a little more comfortable. The more comfortable you are with something, the more liable you are that you're going to use it and continue to use it.
And following up, Alan, to Judy's comments, was telehealth something that Meridian was providing prior to the last year? And if so, how did the demand change and what do you see for the future?
Yes, we did have telehealth in place. We had that going probably for about the last 5 or 6 years with the telehealth option, but it was a slow ramp up as much as we would encourage and offer that. And then, of course, when COVID hit, we went from about 150 services a day, clinical services, therapeutic services, and psychiatric, to 8,000 a month. And we did that. So fortunately, we had that foundation in place to make that quick pivot to where Judy was mentioning, people did not want to come into the office, and we were able to help guide them through that. So that was really helpful. And as we know, as it's been in place more, people are really seeing the efficiency of it and the comfort level. Reducing some of those traditional barriers of travel, as long as they can get a connection. And then, of course, if they have a busy schedule with the family, they have work schedules, not only being more efficient from not having to drive across town, but also we have those extra hours. You have the after work hours and weekends. And that's what we're doing, is we're trying to expand. As we're expanding our workforce, as challenging it is with the shortage in the industry, it makes it more efficient. We don't have to have psychiatrists driving to rural locations where they could be providing those services. So that's very helpful. But it was definitely a big pivot. Unfortunately, the foundation was in place. And as we move along, the acceptance is there, not only by the clinicians, but by the consumers as well.
Yeah, I think telehealth has definitely risen to the occasion for behavioral health, has been, but again, over the last year has really shown and demonstrated the effectiveness of telehealth services. Mm-hmm. So let's switch gears just a little bit, and Alan, I'm going to direct this to you. So there's a lot of technology that's out there supporting behavioral health services, and I understand that Meridian was one of the first behavioral health providers to be both a data sender and a subscriber of the Florida HIE Encounter Notification Service. So tell us a little bit about that, why you chose to participate, what benefits you're seeing, and maybe for our audience, do you mind kind of even just giving an overview of what ENS is, or something I can do?
Sure. Encounter Notification Services is what we have in place, and we've also had that in for about 5 years. And basically what it is, with the consumer opting in, signing appropriate release, we're able to, if one of our clients goes into the emergency room at a local hospital, then we get immediate notification to the treatment team back to us. So that's a great alert. So of course, what that does is it prompts everyone to have that outreach, have that quicker follow-up, and bring them in sooner for an appointment, make sure they're okay upon discharge. And then also that's reciprocated. So if somebody comes in here, we would also send that out to the treatment team. So having that, so basically that notification system is critical for communication, because we know in the traditional models, care coordination is critical. It still is critical, but there's always a lapse or trying to get a hold of the treatment team provider, leaving messages. This immediately allows us to see what's going on with that consumer, and allowing us to reach out with the follow-up protocols that are in place.
Yeah, Meridian has done a great job of incorporating ENS data into operations. Can you share some more about how ENS is helping with tracking and possibly preventing medication contraindications?
Absolutely. Of course, when that comes through, it allows us to start that conversation about where are we with the medications, and of course linking us and having availability to the database as well, to knowing that there's other prescribers out there, just having that on our radar, and then of course engaging with the client, engaging with those primary providers, so we can have that dialogue going on to improve the care or make sure what everyone's doing, we're on the same page. So it's really from a care coordination perspective, the communication. We know communication is absolutely essential, and the more efficient that can be, and with everyone being tight, all the providers being tight with their time, making that efficient so we can ultimately funnel that down into quality care for the consumer.
And a couple of things that I see ENS really supporting with behavioral health is back to that integration of behavioral health and physical health, because they definitely go hand in hand. And you spoke to that, and I just want to be sure our audience heard, even aside from behavioral health information and data, consent, this is all driven by patient consent. So that's one question that we get a lot is, what about consent? Well, we have very strict consent policies at various levels throughout the ENS services, and we can always provide more information about the ENS or encounter notification services to anyone who may need that information, who may be interested in participating as well. So there's a lot of health IT technologies, the ENS services, other services through the Florida HIE, telehealth. So Melanie, from your perspective, why should behavioral health providers be participating in health information exchange, or even the broader landscape of health IT? And what are some of the benefits that you see for behavioral health providers?
Well, thanks, Kim. So I only see a benefit from the participation in the exchange, and starting with the ENS. We see the ENS as a way to break those silos and to fully integrate that care, because even the ENS, and we appreciate the security and the privacy that is built into there and with the patient consent, but this allows us to see real time if the patient has pancreatitis, maybe they've had an asthma attack, and they're in the ED or delivery if they're a pregnant mom. It allows us to sort of have eyes on the patient in the meantime, as well as being able to see if there was a suicide attempt and we need to do an emergency intervention, or if there's an escalation in their behavioral health crisis and they need intensive treatment right away. And for me, sometimes I'm a poor historian by the time I get to my annual exam, and so I have trouble remembering to tell my physician all the things that had happened to me during the year. And we see that with our clients and our consumers as well. So this is an opportunity to enhance that historical data and really provide a full view of what's going on with the entire patient, not just the mental health or the substance use issues that are at hand, but all of the issues at hand, so that we can help the client navigate back to a place of well-being, help their families come together, use data, and have that real-time access in that technology. And as Judy and Alan both have talked about, a level of comfort in using this technology applies to not only the consumer, but the provider as well. So, there's a learning curve there in terms of, how best to be therapeutic in a medium like what we're doing today versus having someone come in person. So, but data is essential and is integral to be able to serve the population that we need to serve, and to be able to, again, bring people to a place of well-being. So we see this as integral as it, and it's just something that we can't afford to be without. So.
And I think you brought up a really good point is, a lot of times we think about the patient's comfort level, but you also have to think about the practitioner's comfort level as well in using the technology, and y'all have mentioned that. So Alan, I want to kind of switch back to you for a moment. So AHCA has really been working very extensively with behavioral health providers for the past months, trying to make sure that they're aware of these services, but there's still, we keep using the word hesitancy. So, but there seems to be some hesitancies for providers to sign on and to either be data senders or data subscribers. But so what is your thoughts on that? And what are some things that maybe overcome some of that?
Well, I think Rightly so. Everybody wants to be extremely sensitive to HIPAA and the patient and that information that they have. So there may be some misconceptions or misunderstandings about what is allowed and what is not allowed to be transferred across those entities. We're pretty safe. We know when it's a crisis, when it's an emergency, there's comfort there. But there may be not fully digging into the HIPAA or the CFR guidelines to know what the abilities there are. There could also be some hesitancies because we are running at full capacity and not always fully staffed. That is an investment in time. So it's important to put out there that the investment will pay off, and there is definitely the benefit for that. It is where everything's moving, and we know the benefits of care coordination. And as I mentioned, this fits right into that. It's another way to accelerate that care coordination and make it more efficient. So that I would say those are probably the two most that were creating some of the hesitancy.
Let's pose the same question to you, Melanie. What do you hear or see from your perspective and working in your organization?
So I think the hesitancy is just, like Alan said, is a level of comfort with the provider, making sure that we adhere to the privacy standards, which definitely has worked hard to meet and to exceed those privacy standards that are there. A part of it is the perceived cost of engaging in this, and having technology staff on hand to be able to interface the data that comes in with the EHR or the EMR, and to be able to handle that not only from the technical perspective of just the data coming in and data going out, but as well as using that in a meaningful way. And meaningful, I know, has a federal definition, but to the provider as well, something that's useful in the daily treatment of their. And I think sometimes it's hard to see both a short-term and a long-term benefit from this. But as Alan alluded to, cost is ever increasing in the healthcare space, and this is certainly a means of this data sharing, and this being able to recognize which treatment providers are involved ultimately will result in cost savings to the state, to the provider, to the community, to the individual. So the more that we can do to enhance that communication and those coordination of services across the millennium, whether it's from birth to someone geriatric, someone who has private insurance, who is a Medicaid enrollee, or a Medicaid subscriber, or receiving is unfunded. We're much better be able to coordinate that. But again, the barriers seem to be understanding cost, and then being able to work with the technology. And I have to say a shout out to ACA staff here, because you've worked so hard with grant monies coming in to lower the cost, at least for the initial year, for providers, as well as to really work hard on the technology and that interface, and work with our EHR vendors so that there are, and I call them patches, I'm sure that's not the technical term, but a way to be able to integrate that data into our system. So thank you for that.
Those are all really good points, and will really help us, as we look at messaging and outreach and things along those lines. So Judy, I want to give you a chance. We just again keeping in the theme of hesitancies, and I know telehealth is kind of your area, but how does Health IT or HIE services support the services that you're providing, and what hesitancies are you seeing there?
Actually, we're not seeing any hesitancies at this time. We've got 15 telehealth support specialists in our clinic who work with providers and clients to have things run smoothly. Our therapists are well trained in the system and can assist clients if needed. Platform has a live feature to assist the client if necessary. And what sets us apart is we're established, innovative, we're constantly evolving. We anticipate future needs, so long before telehealth was mainstream, we built this whole shift, in the delivery of healthcare.
Melanie, you recently hosted BHCon 2021 with the theme Going the Distance, in which ACA presented on the floor to HIE. Both Kim and I were there. Why did you choose that title, and what common themes emerged from the conference?
So when we took a look at planning the conference and what theme did we want to use, we really wanted to recognize our healthcare heroes and recognize the strength and the tenacity. Our providers never close their door. We're not typically considered as a frontline service provider, but we are. We service people in crisis. We service families, children, adults. Services are available to the entire community. And so we just wanted to recognize and to give a shout out and some support to all of our healthcare providers who have gone the distance, who endured the pandemic, who pivoted to telehealth and remote services almost overnight, who made innovations in their practice, because of the demands that were there, and who learned to juggle the demands of work with the extended hours and the telehealth, as well as and working from home and not in the office with the demands of family and their own mental health needs that were there. So we wanted to create an atmosphere where everyone felt supported and recognized for their hard work, and we applauded their efforts and really just shined a light on all of the good work that's being done in Florida in the behavioral health space.
In the conference, and it was a great conference, there were a lot of sessions on self-care. You mentioned self-care earlier as well, and maybe Judy, you did as well. Share kind of why self-care could be so important for those working in this field, as well as for those who just may be listening today.
Sure. Self-care is important to all of us. You can give and give and give, but at some point you've got to be re-energized so that you can go forward. And so that's especially important in the healthcare space, and really important with those who are in who service those with mental illness and with substance use disorders, because you tend to take on the anxieties and the problems of your clients if you're not careful, and you just have to be able to nurture yourself. So it's very, very important to take time for you to recognize when you're at your limit. And when you need a break, because we all feel like there's one more thing that we need to do, or there's one more client that we need to see. But sometimes it's to the benefit of everyone for us to kind of step back. And so we wanted to give our healthcare professionals tools and some techniques so that they can care for themselves. We're seeing the stress, manifest itself in physical symptoms, like I talked about, which means sometimes it's just a visit to your primary care physician. Sometimes it's resulting in a hospitalization, for anything from a pneumonia, to a heart condition. Any of those things, can be brought on. We're hearing stories of, staff that have become ill and had to be hospitalized, or had to have take a few weeks of sick time to be able to recover. And it's just important for all of us, for the health of our families, for the health of ourselves, for us to be able to care for ourselves and to realize and to have, like I said, those techniques where whether we just spend 10 minutes a day in meditation, whether we go for a walk in the mornings before we come in, whether we indulge ourselves in our favorite food, or treat ourselves to, a fruit juice that we like, or a soda, or sometimes we spend a couple hours watching a movie or reading a book. It could be something as simple as that, or it can be going on vacation somewhere. We just need to be able to take care of us so that we can take care of others.
It's just so important to take that time to give back to yourself.
It's also time to grieve, because over this last year, we've not had weddings and graduations and all of those milestone events that we typically see, and we're not able to. And so there's some grieving going on, as well as, the additional stress, financial stress, and the stress of, fear of, the pandemic spreading, and, questions around, what do I need to do medically, as well as, environmentally. And so it's been really, really tough, and we need to recognize that.
Yeah, I know, Judy, you mentioned that you had like your staff doing some self-care.
Yep.
Do you want to give any examples of some of the things you implemented?
Oh, I agree with Melody 100%. So, because this has been changing for a lot of people. Like, people had children at home for maybe the first time, trying to teach them with school along with working, everything else. Or you had people in your home you normally didn't have in your home at this time. So that can bring on, a lot of stress. And we did everything from a compassion fatigue workshop to the staff, emailing back and forth, like what self-care they did. When I check in with my staff, I ask them like, hey, what are you doing today? One thing we do is when we talk to each other, sometimes we'll take a walk with each other. So, and we can also do that, you know, on our app. But we can do that and say, why don't you just take a walk with me right now? And it makes you get up and get out and be in nature, which we know is great for us. And, you know, spend that time with each other, because we all know mindfulness in the moment, things will be okay. They're going to be okay. It's anxiety, fear of the future, you know, or depression, ruminating on the past. So yeah, just staying in that moment. There's so many virtual things being offered right now as well. Virtual yoga, touring a museum, touring a zoo, so many things that, you know, that people even enjoyed as kids that they need to get maybe back in touch with again a little bit. You know, get back in touch with the little child in you, and that helps out, because this has been, Melanie, agree 100%. This has been a year of grief and loss and coping, and we're in that moment of we just don't know what's going to happen next, and a lot of angry people because some people don't deal well, you know, with change, or with being told this is something you need to do that they are not prepared to do. So the self-care, I shared everything from the BH conference. I loved the conference, shared everything I could. And yeah, it's something we need to do more of. We really need. We need to, you can't take care of somebody else unless you can take care of yourself first.
And I think it's really great. There are so many tools, IT tools now available, and Health IT is really, you know, played a pivotal role in so much of that, not only direct care delivery, but also self-care, and just kind of bringing it all together as well.
Yeah.
And we've had to, I want to say, to pivot, you know, and be innovative with self-care as well, because we are a people who do well with personal touch, and with that in-person, you know, really experience is very important to us. And so to have to do things virtually now has really caused some, you know, some change in the way we do things. And so like Judy said, and Alan too, just, you know, having that conversation, whether it's on the phone or, you know, via Zoom or, you know, some other technology, or being able to go for a walk is really important, because that personal touch, you know, that personal connection is really what keeps us going. So you know, we're all learning and we're all adapting.
Just to switch back a little bit, I wanted to pose this question to all of the panelists, but I guess we'll start with Judy and then Melanie and then finish with Alan. What recommendations do you have for other behavioral health providers that may be leery of moving toward the use of technology in providing behavioral health services?
Oof, well, I think one of the many reasons that we became behavioral health providers is we believe in change. We believe people can change, and change is possible. So it's now time to embrace the change. So I believe that the pandemic it forced us to change in how we interact with others, how we work through technology. You know, I would suggest people know your HIPAA standards, your privacy policies, know your system, know your safeguards, train your staff and treat them well, because as we know right now, difficulty hiring people, we want to retain the excellent people we have, and we want to bring more people, you know, to us. Educate yourself on the different ways to engage with different types of clients, because this is different for a lot of people. You know, as Melanie said, we're touchy-feely people. We're trying to find a new way to connect with someone differently than we've done it, you know, in the past. Know your billing procedures, your documentation standards. Hire the right people. You know, telehealth is not for every client. We're not saying it's for every client, but for the clients we serve, we need to serve them well. And for the clients that are not suitable for telehealth, we need to refer them to someone that will give them the service that they need.
Melanie?
I'd like to encourage everyone to embrace technology, and rather to be fearful of it, and to realize that there are efficiencies that can be gained by the use of technology. You know, it may be difficult to, you know, to interface it in the short term, but in the long term, the benefits are huge in terms of, that integration, being able to meet the demands for the services that are there, and be able to mitigate the workforce issues that we're seeing, and to be able to increase quality and to do more and to do it better. So even for those who are not early adopters, we encourage you to really, reach out and try it, and you'll be surprised with the effort and with the results that are there. But we just see nothing but good and gains that can be made by using technology.
Great. Alan?
Yeah, I would say well covered on that topic, and also looking at from a perspective that it's another tool in our toolkit to deliver services to our clients. So yeah, it's definitely a big step. There's been a huge pivot to the telehealth, but when we talk about, we know that there's always going to be a challenge with having enough therapists, or hopefully not always, but at least for the short term, it's another way for us to bring those services to the client, just as we would when we think of when we're serving clients. There's more to the therapy than just what's in the session. Hopefully they're learning and practicing those skills they're applying, but also, are they linked up to their spiritual or faith connections? Are they involved in their leisure activities and the hobbies and the wellness? Are they involved with National Alliance for Mentally Ill? Maybe you have a local clubhouse, whatever's going on, arts, etc. As we're trying to spiral up these talents and strengths in our clients, this is another way to add to the whole array of services that we're delivering. So yes, definitely the technology and the support and the future. And the great thing is there's such a good comfort level now with therapists and the clients, and adding it to the big array of services.
Great. Thank you so much for joining us today in this great conversation about behavioral health. I'd like to highlight that the Agency for Healthcare Administration is partnering with KEPRO, a leading healthcare management organization, to offer a mental health helpline that is available at no cost to eligible Medicaid fee-for-service members ages 18 and over. The helpline is open 24 hours a day, 365 days a year. Services include short-term support, long-term treatment options, or other emergency services. So for those who are interested, you may visit the ACA Recipient Resources webpage for additional information. As we touched on earlier in the discussion, the Florida HIE's Encounter Notification Service, or ENS, as you heard a few times, can assist in and support care coordination by tracking patient encounters through admit discharge transfer data. And to find out more about that and how the service works, visit florida-hie.net. We hope that you'll join us for the next edition of Health IT Matters on Thursday, October 21st, where we will discuss how health information technology is helping those in rural communities. Again, I'd like to thank you all for joining us today. And with that, I'm Corinne Slaughterback, and this is Health IT Matters.